The views and opinions expressed do not necessarily reflect those of Access Fort Wayne, the Allen County Public Library, or any other supporting groups. If you'd like to produce a show, call us at 260-421-1250.
Hi, I'm Dr. Rudy Cashman, neurosurgeon in Fort Wayne, Indiana for 41 years, but I'm only 39 years old. No, all kidding aside, I have a wonderful guest with us this evening, Dr. Kevin Berning, director of the Burn and Wound Center at St. Joe Hospital, and we're going to really explore prevention and treatment of burns, which of course are much more common at the winter time. Dr. Berning, tell us a little bit about the Burn Center at St. Joe Hospital, what you do there, what type of problems you're seeing there, for example.
Sure. Thank you for having me, Rudy. As you know, burn injuries are very significant and severe. Thankfully, most of the patients that we have, we are able to treat and get them out of the hospital, and we treat many outpatient burns as well. We see roughly 800 new burn patients a year, most of those being in the outpatient setting. We have pretty much a brand new burn center at St. Joe. Many people don't know about it yet, but we moved from the 5th floor to the 2nd floor at St. Joe Hospital and developed a whole new burn center with 12 inpatient rooms and 12 outpatient rooms as well. So it's really a significant and state-of-the-art facility we have here in Fort Wayne.
You're right. I didn't know a lot about it, and it's very, I understand it's a very modern unit.
It is.
Brand new with highly trained physicians and surgeons like yourself. And sort of to begin the discussion of the subject a little bit, how do you classify burns? You know, I've heard first, second, and third degree,
Sure.
but even as a neurosurgeon, tell us a little bit about the detail of that.
Sure. First degree burns are really basically a severe sunburn. So you get redness of the skin. The burn does not blister. The actual skin does not open up. But later on you'd get peeling, you know, like again a severe sunburn. Thankfully those are, you know, not that significant. It can be if it's a larger area potentially, but most of those will just go on to heal on their own. A second degree burn is a burn that actually blisters and the skin peels off. You get basically an open wound where you have a pink moist base of the skin underlying it, and that burn will heal from the hair follicles. So you'll actually get migration of skin cells out of the hair follicles to heal a second degree burn. And generally a second degree burn will heal within 2 to 3 weeks. And again, we don't need to do anything other than dressing care, keeping the wound clean. In a third degree burn, you've actually injured the full thickness of the skin, and you've also injured the hair follicles and all the components of the skin, including the hair shafts themselves, all of the glandular tissue, that sort of thing. So those are burns that need surgery to heal, unless they're very, very small, because they do not have any component of healing in the middle part of the wound. It has to heal from the edge, and probably everyone has seen burn injuries where patients have let those heal when they've been full thickness, mainly from third world countries at this point, and they'll get contractures where their joints won't be able to bend anymore, that sort of thing. Thankfully, since we treat these very aggressively, we do not see that as often. You know, we still can occasionally, but most of the time we do not see that type of problem long term.
So you have to place some grafts on those third degree burns.
Exactly.
I've heard recently, which I don't know a lot about, perhaps you tell us, about some artificial graft materials now.
Sure.
Could you tell us about that a little bit?
Essentially, at this stage, the grafting materials we use are all temporary compared to the patient's own skin. So we use cadaver graft as temporary skin coverage. We use some other products as temporary skin coverage, sometimes pig skin, that sort of thing. But as of now, we only have the patient's own skin to really replace for long term. There are some studies being done, I think particularly in the Cincinnati area burn center, where they are actually looking at growing skin specifically for a burn patient, and there may be some utility of that in the future. We do on very large patients, generally over 75–80% burn, we will send off a portion of their skin to grow in a lab and then get that sent back and actually use that for grafting. But it's not as good as harvesting the graft and placing it, because it's just a thinner layer. You don't have the dermal layer, you have just the outer layer of skin in that situation.
If you had a patient, say, with a 50% burn, what are the odds of saving their life?
Well, it kind of depends on the patient's age. You know, a young person, you know, in their 20s, 30s, it's very likely that they'll survive that injury. It is possible that they wouldn't, but most will. Now, you get someone in their 60s, 70s, the majority of those will not make it through. There's kind of a rule of thumb: if you add the patient's age to the percent burn, it's roughly the mortality of the injury. So if you add the patient, burn a 50% with a 70-year-old patient, you're roughly looking at a very little chance that they're probably going to make it out of the hospital, because their organs don't have the potential to keep up with the injury.
Yeah. So you get a 70-year-old with a 50% burn, he's not going to make it.
Most likely they won't.
They won't. Although you'll, of course, try very hard.
Sure.
And tell us a little bit, and I'm sure you know a lot about this. What are the most common causes of burns that you're seeing today?
Well, that it's somewhat variable depending on the time of year. This time of year is more common for actually residential fires and fires within the home, cooking type injuries, grease fires, those kind of things. See a lot of grease burns where someone's cooking and the grease catches fire. A lot of times patients will take it and try and run out of the house, and once they hit the outside, it'll spill on them, kind of come back. So the best thing to do with a grease fire is just to use baking soda or flour or something to try and get that grease fire out, not to run with the pan out the door. So this time of year, those are the things we see. We still see a lot of scalding injuries in children this time of year and throughout the year. It's good to keep your hot water heater at below 120 degrees Fahrenheit to try and prevent those types of injuries.
I didn't know that until I read about it today. That's something that probably 90% of the people don't even know.
I would say a lot of people don't know that, but it is a significant cause of burns, particularly in children. And there are still roughly probably 10 to 20 children a year in the country that die from scald injuries. It's not very common that a child will die from a scald injury, but it can occur. So,
what about cigarette smoking? What percent of the fires do you think you're seeing from that? Do you see this commonly?
It's a fairly common type of a mechanism for a fire. Roughly around 5 to 10% of house fires are caused from poor or careless cigarette smoking. Roughly, of those 5% of house fires, about a quarter of the house fire deaths are caused from careless smoking. So if someone is smoking, the fact that they're right close to where that fire starts is very significant, and about 25% of the residential fire deaths are caused by careless smoking.
Carelessness. I've been hearing lately a lot also about met labs that exploding and horrendous burns from that. Is that true?
It is. It's a very significant current public health problem. Not only are the drugs themselves a problem, but the injuries that we deal with in the burn center are very significant and usually very severe injuries because these chemicals and things are highly explosive, and when patients do get those injuries, they're very severe. And in terms of the public, it costs a lot of money to take care of those patients, and the majority, I don't know if I've seen one that has actual insurance. So it's something that it's a public health type situation in terms of covering the cost of that as well.
Could you give me a rough guess? Suppose a person had a 50% burn and they'd be in the hospital months, right? Months?
Sure.
Give me a guess where the bill would be.
Yeah, it's hard to say. It would probably be in the $1
million
to $2
million range. Yeah. And the majority of those people don't have insurance, and we, the taxpayer, are covering.
Yeah, it's a very significant problem for burn centers because across the country, more and more care is not reimbursed, so trying to keep the burn centers open is it's going to be a problem long term. So it's something we're going to need to address.
Well, thank God for St. Joe Burn Center. We really need them. And what is the first thing we should do when someone is burned? Maybe let's start in the house, for example.
Sure.
A child has some hot water spill over them, and they clearly have been burned. What should mother do?
Sure. First thing to do is cool off the burn, but the last thing you want to do is use ice, actually. A lot of people want to use ice, but ice is the last thing, because if you use ice for too long, you could actually cause a thermal injury the other way. So, and that's one thing we see this time of year in the burn center too, is frostbite. It's a type of thermal skin injury, so it's something we see. But what you want to do is you want to cool the skin off. So use cool water. Run cool water over the area, and then once you get the cool water and get things cooled down, then putting just kind of a dry, clean sheet or something over that area, and then getting medical attention. If it's a small area that hasn't opened or blistered, sometimes you could treat those at home. I would say probably anything that's blistered, you probably should see someone about it just to make sure it doesn't get worse, because there are definitely chances of infection and problems with that. Any areas where you have a burn that's pale and you don't have much sensation, again, full thickness burn injures the nerves too. You usually don't have much sensation in those, so that would definitely be something you want to
go to the emergency room with. Suppose I walk in the kitchen and the wife is on fire. What should I do?
Well, the first thing is, again, putting out the fire. So, a lot of times, we talk about stop, drop, and roll. Now, in a kitchen setting, that may not be as feasible. So trying to, find a big sheet or cover or something like that, or a coat, just to put that fire out, just something to smother the fire. You could also use water. If you have some water handy, bucket of water, you can use that. But that's the first thing to do, is extinguish the fire. And then once you extinguish the fire, make sure you take any clothing that's still warm or melted clothing off, those kind of things to decrease the exposure to that heat.
Suppose I'm coming back from the lake and we walk in the house and did not know it, and the house is on fire. What should a person do?
Well, the first thing would be to escape at that situation. Make sure you get out of the house.
Just get away from it.
Yeah, make sure you get out of the house. You need to be aware that smoke can be a significant problem. And inhalation injury, smoke injury, carbon monoxide poisoning is a significant component. So you want to get out as quickly as you can. Smoke tends to rise, and also heat. So you want to get down low if you're in a place where you have significant amount of smoke, that kind of thing, to get out of the house. And we always talk about too, if you are if you reach a door, make sure that there's not fire on the other side, touching the door handle, trying to make sure there's not something on the other side, because that can be a significant problem too, opening the door into an area that's already burning significantly. If
the skin wasn't that damaged, will singed hair grow back?
Singed hair will grow back. Yeah, singed hair will grow back. In first and second degree burns, the hair in those areas will grow back. In a third degree burn, you will lose hair in those areas. Because those areas, again, are the areas where things can heal out of. And with a full thickness injury, that injures the hair as well. The hair.
Could we review once more so we absolutely get this straight? When do I need to see a doctor?
Again, that's depends on the patient as well, but anything that the person feels uncomfortable about, I would say see a doctor. That would be a big thing. Anything that's blistered, anything that seems to be an area where you lost sensation, something that looks pale, those kind of things. Also, the other things to consider are burns that are across joints, areas of the face or head and neck, things that are going to be visualized. Those are definitely areas that you want to, seek treatment. Anything over, kind of a palm size, which we would consider about 1% body surface area, you probably should have at least someone evaluate that. You get up to a little over 10% or 10 hands of burn in terms of skin involvement. That's when someone may need to be admitted to the hospital. And if it's full thickness, some patients even need to be admitted at a lesser burn. So.
And burns cause swelling, don't they? So if it's totally around the finger or totally around the neck, or an area where it might leave scarring, might be best to see a doctor.
It is.
Because it could cause some permanent changes in your appearance.
Usually the first 2 days after burn injury, the body will absorb the fluid, and unfortunately it will actually, what we call third space, into the tissues. Instead of staying within the vessels, it will actually go out into the tissues, particularly the tissues that are burned. So the biggest need in a burn patient the first 24, 48 hours is fluid. So a burn patient, 50, 60% burn, we're going to use up to 10 or more liters of fluid IV to get them through that initial 24-hour period. So it's just a huge amount of fluid. And a lot of that, your kidneys will not start to release that, so your body will actually hold on to a lot of it. Any areas that are full thickness burns can actually then significantly cause problems with the blood flow and circulation distal to that. So if there was a burn on the forearm, anything down further away from the body can have problems with circulation. So sometimes in those situations we'll do what's called an escharotomy, where we'll actually release the burn, let that expand a little bit more to allow for that swelling. Because it can cause significant problems. We recently had a patient come in to the burn center not long ago where very severe third, maybe fourth degree burn. A fourth degree burn would be where it's actually down to bone or deeper tissues. And in that case we needed to do those escharotomies or releases of that tissue very early on.
So you frankly operate a lot of these patients, don't you?
We do.
Skin grafting, releasing tissues to save their lives. Electrolytes need to be replaced, a lot of fluid. So in a really acute hospital setting, intensive care is extremely
it's
important. Do these patients have a lot of pain?
Well, again, it kind of depends on the depth of the burn. If it's a full thickness burn, the burn areas themselves initially don't have much sensation, so it's not as painful of an injury. Now, someone with a larger second degree burn, even, I mean, we've all had smaller second degree burns, they hurt a lot because those nerve endings are out there and
they're still
raw.
there.
And those are very significantly painful, and occasionally even smaller burns, we have to admit them for pain control. Even in that situation, even though we're not going to need to do surgery on that patient because it's a second degree burn, we'll sometimes need to admit them to get the adequate pain control for them to get through the initial stages of the injury.
Yeah, one of my favorite topics is talk about try to help people avoid cotton addiction, for example.
Sure.
Tell me, you have a severe burn situation. What's the average length of time that you have to give narcotics?
Well, it's kind of variable, and one of the things that we talked about initially too is the length of time that a patient stays in the hospital. And again, anyone over like a 10% burn, 10 to whatever percent, we tend to estimate about a day in the hospital per percent burn. So if you have a 25% burn, you're looking at a probably 25-day hospital course. Again, it depends on if it's second degree or full thickness burn, but it can be quite variable. So you're obviously treating them during that course. A second degree burn will tend to heal in about 3 weeks. So usually by about that 3-week mark, you're able to get them off of all narcotic pain medicine. Now, a third degree burn patient where you're grafting and that sort of thing, you're going to need a little bit more extended period of time in terms of treatment of those, in terms of pain medicine. But the way we do it is we actually do limit the amount of time, particularly for the really strong pain medicines. We taper it off over a period of time. So it really does help that. And I've personally have not seen anyone that I've treated from a burn injury get a true addiction to the medicine because we're able to taper it off. They have it when they need it, but then they don't have it when
Kevin, I'd like to
not
congratulate you,
so.
frankly. I see that not, unfortunately, not very commonly, where you have an endpoint. You know, I wrote a book coming out shortly on chronic pain, and one of my chapters says an endpoint. You got to have an endpoint. I'd like to congratulate you for doing that because
thank you.
I don't see a lot of that because that really concerns me. I've read that only about 60% of the people have an escape plan in case of fire in their home. Is that correct? Is that
sure. You know, it's something that I don't necessarily talk to patients about, I guess. But I would say that there are probably most families probably don't talk about it enough. You know, it's probably something that everyone, particularly everyone watching the show, should sit down, talk to their family members, particularly the younger family members, on what to do in terms of a fire. And I have to be honest, I don't think I've done that with my family. So it's one of those things you just don't necessarily think about when you're so busy doing other things.
Yeah, you know, I've talked about it at home, but I don't think I've considered it to be the perfect plan. Like upstairs in my bedroom, I have the And I had a fire actually years ago.
Really?
Where
Yeah.
I had to move out of the house for 8
Yeah.
months. It happened, fortunately, from a recessed light, and we were gone.
Sure,
So
sure.
we survived it. But like in my bedroom, for example, I mean, I have a window I can maybe make it out of,
Sure.
and I have a door. But do I have something to smash the window? No.
Maybe not. Yeah.
Yeah, I need to get a sledgehammer
exactly.
or something,
Yeah.
or just a hammer. That in case you have to get out that way, you
Yeah.
can't use your hands, especially a surgeon, or
Sure.
to
Exactly.
So an escape plan
Yeah.
is very important. Rehearse it with all the children, and I really like to emphasize that because house fires occur. It occurred to me.
They do.
And,
Thankfully, when you see the paper nowadays,
Yeah.
majority of house fires are. It seems like most of them occur when people are not at home. So we do still
Yeah.
have house fires, but majority of house fires, a lot of times patients aren't home.
Yeah.
And we are seeing more people that have smoke detectors and those sorts of things. And I would say a majority of patients we see do have smoke detectors, and it does seem like that is something that people are more aware of in terms of that safety kind of aspect.
And that's
of things.
very important, those smoke detectors. Make sure they're working. Because a lot of us have them sometimes, the batteries runs out, we're on vacation, it ran out, and then the thing goes dead. We don't even know it's not working, so to have that checked. I think we also need some carbon monoxide monitors, don't we?
I agree.
I look at my house. I have a new car there, and the mechanics are different than my other car. And I walked in the house one day, the car was still running.
Sure.
That could have been fatal.
Yeah.
That could have been fatal. We're now going to have carbon monoxide monitors by the fireplace in the bedroom, because it's if your car is under your bedroom, some famous people have died that way. Garolitis, the tennis player, he lost his life that way at a friend's house. Carbon monoxide came up and killed him.
Well,
So those monitors, I think, are very important.
Yes, particularly this time of year too. I mean, carbon monoxide is a significant problem. We're in the house more. And I think carbon monoxide detection is a good thing.
Yeah, in the home, I think some general summary recommendations I think we talked about. We show you smoke alarms, carbon monoxide alarms, and there should be one alarm outside the bedroom. Change batteries of smoke alarms, keep emergency room phone numbers handy, and have a practice rehearsal with your children and husband. I said, what you're going to do if there is a fire, and designate a meeting place outside the home. Don't run back in to save somebody, because odds are you'll die also.
Yeah. And we've seen that.
As tough that is to obey, especially if it's a child, or we love our animals. I mean, I'm not sure that I could do. My dog and cats were there, and I was outside, and they were still in there. I'm afraid I might be tempted to go get them. So you got to resist that.
We have seen that before, where someone will go in and they won't even realize that person's already out of the house, and they'll go in to try and save them, and they'll be overcome. So we've seen that before.
Let me ask you a little tougher question here. What if you're trapped in a burning building? What are some general recommendations there?
I would say, again, the key thing would probably be to get low. You can, particularly if the fire is outside the room you're in, you can use, if you have access to moist, sheets and towels, you can put that around the base of the door, trying to prevent smoke from coming in there. Trying to cover up, if you have any access to, oxygen, maybe break a window so you can breathe or something along those lines. You need to try and remember all those things, and obviously try and get help. I mean, most of us have cell phones these days, and I think that can save a lot of lives. Is if you have your cell phone with you, make sure you call for help right away. Yeah,
that's very important, especially in car accidents and in car fires. That you may be upside down, but if you get a cell phone. I know someone saved their family that way. They were able to call the EMS. And also, if you're in a room, I guess you should touch the knobs first to see if they're hot or not. If they're hot, don't
go into that room.
Don't go into that room.
Because just the oxygen in that room, opening that door could cause it even to explode.
To explode at that point. And you ought to stay low. And also, you could break the window, wave a towel or something, that people know that indeed there's a live person in that room, especially, say, in a hotel room. Let's talk about the hotels and workplaces for fire safety. I mean, you're staying at a hotel for the weekend, and the alarm goes off. I would think before you go in that room, you should know where the exits are. Wouldn't
sure.
you agree, Kevin?
Yeah, and it seems like most of the hotel rooms, and it's probably a law, most of them on the back of the door will have an escape route right on the back of the door. So I think that would be something that everyone should look at when they first come into a room. Yeah. I think that's a great idea. Yeah. Well, in terms of workplace safety, one of the biggest things we see workplace-wise is actually grease burns, I think, a lot of times in fast food type industry, that kind of thing. Also, I mean, anytime you work around, you know, hot stuff, again, have a plan on how to take care of things, how to be safe around that, you know.
If you're working at a fast food restaurant, be sure you know what the safety rules are, which I'm sure they have in place, but you got to know them.
Yeah, exactly.
If you're working there, that your fellow has some grease on them. What should you do right away? You could save, you know, a lot of trouble. Speaking about hotels, to put a little humor, it's hard to put humor into here, but I remember after a tennis tournament, I was staying in a hotel in Grand Rapids, and they had told me the night before they were going to have a fire drill, which by morning we forgot about. My wife and I, you know, barely any clothes on, and there's a knock on the door, and we open it up, and there's a fireman, and he says, we didn't realize it was a fire drill. We ran out of the hotel, barely any clothes on. We were on the evening news.
Sure, that's great.
They filmed us for the evening news. Just to throw a little humor out here. And if you go to a nightclub, you know, you hear about these nightclub fires.
There's been some
I would
huge
think
problems.
If you're dancing all night and there's hundreds of people in there, know where your exits are at. Know where your exits are at, because if something goes wrong, there's going to be panic, and you better damn well know, you know, where you're heading. Let's look at statistics a little bit. I hear that someone dies in a fire every 135 minutes. That seems a large number. And someone is injured every 30 minutes in the U.S. from a fire.
Yeah, it's a pretty significant number of injuries, but again, most of those are pretty minor, the majority of them. But there are somewhere between 4,000 and 5,000 deaths a year from burn injuries. So it is significant. There's roughly 125 burn centers across the country. There are some states that don't even have a burn center. We happen to have in Indiana 2.
That seems not believable.
But
only 2 in Indiana?
There's only 2 in Indiana.
I'm totally surprised.
We have a burn center in Fort Wayne here that we take care of adults and pediatric patients. And then the burn center in Indianapolis at Wishart, and then there's one at Riley to take care of the pediatric patients. So those are the only 2 in the state of Indiana, and there are some states that actually have no burn centers. And unfortunately, the way of burn centers, again, because of a lot of the problems we were talking about with non-funding and that sort of thing, are starting to fail. So thankfully, we have very good support with our administration here in Fort Wayne, and it's something that you know, we're continuing on in terms of developing other programs to support the burn center, and one of that is taking care of wound patients as well in that center. So
I think anytime you can help a burn center is important. You can see the problem, that millions of dollars unpaid for. And I had no idea, Kevin, that we had only 2 in the state, and that some states have none. Into this modern age does not seem believable.
Yeah, it's frustrating, because it seems like in some respects, you know, we've developed a lot of treatments for burn injuries, but as time goes on, because of you know, the process of not having the funding available, sometimes we're slipping backwards, I think, in some respects. So.
It's very interesting. I understand there's approximately 10,000 people in the U.S. die every year from the complications of burns infections. So is that an additional to the 5,000?
Well, you know,
or is that mixed in there, you think?
I think it's probably mixed in, most likely. Yeah, I think that data probably is mixed in. The majority of patients that end up succumbing from their burn injuries is usually from kind of an infectious source, because what happens is your body gets overwhelmed and your organs start to have trouble. So your kidneys start to fail, your liver starts to fail, and you can have overwhelming infections in those situations, and a lot of times those are more pulmonary, actually, in a burn situation. And I would say, I tell all my families this when a large burn patient comes in: you're going to have a kind of a roller coaster course. You know, some days are going to be good, some days aren't going to be as good. It's pretty much on a larger burn patient, greater than 50%, that they're going to have pneumonia throughout their stay. It's just something that happens. We treat it, get them through that. It's just a real roller coaster ride, particularly for the families in terms of that. And also the nurses that take care of the patients. We have just an excellent staff at St. Joe. a lot of long-term
Yeah.
tenured nurses, and they do just an excellent job taking care of the patient and the family. They just really do a wonderful job.
Yeah, frankly, I've heard nothing but the best about the Burn Service St. Joe for years, and I really appreciate you working here. Tell us a little more about the physiology of a burn. I mean,
Sure.
you got a more than 10% burn. What happens to the human body?
Well, the biggest component of a burn injury is that it's affecting our largest organ, which is our skin. The skin protects us from many things, only one of which is infection and problems like that. It protects us from many other things as well. So we're basically damaging our largest organ of our body. And what happens is, again, the outer layers get injured. Particularly in a first-degree burn, it's not as significant. Your body can still protect itself. Once you get into the second and third-degree burns, you've actually injured that protective coating. So any of those burns, you lose a significant amount of fluid throughout that,
Yeah.
particularly the first couple of days, and then it starts to taper off. But throughout the whole course, your body cannot hold on to the fluid that it usually would have. Initially, your body will accept these things and start to work towards trying to heal things, but in some respects those can be problematic as well when your body goes into overdrive to try and heal.
Yeah, is there an
heal the
immune
injury.
reaction? Will
There
the
is-
body
there can be
react to it
some
like a
immune-
foreign body?
It can, well, sometimes what
Yeah.
happens is you get to the point where your immune system is down because of the injury. So it
see.
actually will decrease, and your risk for infections and other things will have a problem.
What's the rate of infections in major burns?
Well, I would say, again, like we said,
Yeah.
with the pulmonary infections and
Yeah.
the risk for pneumonia, I would say the majority of patients will have some sort of infection
Along
and a
the
larger
way.
burn. Yeah,
Larger burn.
and it's something that we know to look for and know to
Yeah.
treat, but it is something that we see in
What's the
in
most
major
common
burns.
bacteria? Is it staph like everybody else, or is it
Well,
no?
it does
different?
vary. It varies a
varies?
little bit.
Uh-huh.
We see some staph, a lot of the skin organisms. Because it's a moist environment, we see Pseudomonas as a problem occasionally. We see other bacteria that can be a problem as well. But it's kind of a wide variety, and we work closely. I mean, one of the fun things about working in the burn center is we work with so many other aspects of allied, health. We have our pharmacists there at our Thursday morning meetings to talk about all the patients.
Yeah.
We have the nutritionists, dietitians. We have the microbiology people. We have the therapists there. We have our psychologists there that we talk about each individual patient on every Thursday morning, and they're all there to have their input on how to take care of the patient. And I don't know anywhere right now in medicine where you have that much input, taking care of the patient. It's just really a neat place to be working.
Let me ask you another interesting question here. The Monday night I'm giving a lecture on music and healing at the auditorium at Lutheran Hospital. So I'm kind of interested in that. Do you use music on your patients? They're there for a long time, and their own thought process and moods are extremely important. Do you use music at all?
Well, I mean, some patients the families will bring in music for the patient. They'll bring in things that the patient likes, that kind of thing. And I think it's very important, for the families to be there, for the families to interact with the patient. Even though most patients do not remember their ICU course or being in there, when the severe burns, happen and we're treating them, a lot of patients will come back in the outpatient setting and it's like we're meeting for the first time, even though I've been taking care of them for months.
Is that right?
But during that time, I think it's very important, though, that the family's there, soothing them, with, I think music is a great way. They'll bring in the music the patient likes, that kind of thing. I think it is a significant
nice to hear that.
component.
I think to me it's a big item in healing. I was reading a lot of the books of Oliver Sacks in healing, and I think it's very interesting. What type of diet do you feed a major burn? Is there a special diet that you give them?
Well, it is a significant component. I mean, that's one of the things that people need to heal is we have to get the protein, particularly that we need to heal an injury like that. Majority of patients with a severe burn are on the ventilator. cannot eat. They're having a lot of medicines. You know, they're basically in kind of a induced coma type situation where we actually keep them sedated. So in that situation, they're not going to be able to eat on their own. So we generally will have a feeding tube in, give them artificial nutrients, not necessarily artificial, but manufactured nutrients down into their intestinal
high
tract.
protein type of.
And it's very, very important in burn injuries to have that. And a lot of surgeries will actually have the patient stop eating, 6 to 12 hours before surgery. In a burn patient, we'll actually get that feeding tube down past the stomach, and we'll feed right throughout surgery because it's that important to get that nutrition in.
Are some of these surgeries very long, or an hour or two, or sometimes 4 or 5 hours?
Some of them can be 4, 5, 6 hours occasionally.
Is that right?
It's quite variable in terms of the amount of surgery you need to do. We try and limit the time somewhat, and we actually, the burn center has its own operating room, and we're able to keep the temperature quite warm in that room. So there's a lot of times that we're keeping that temperature in that room 95 to 100 degrees to keep that patient's temperature warm, because that's one of the things physiologically that your body loses ability to control its temperature when the skin is injured too.
Yeah, there's no skin to cover you up, and you're going to feel
you
cold all the time.
Yeah, you lose a lot of heat.
Can't maintain the
heat. And once the body heat goes down, a lot of our physiological processes start to shut down, particularly in terms of coagulation of blood. So if someone's blood body temperature goes down, you can have significant problems with bleeding, that sort of thing. So we have a very hot room, and this operating room has special control of the temperature. And a lot of times working in there, we're sweating and we're having.
You've got to lose 10 pounds time you get out of there.
And none of us like to work in that environment, but it's the safe environment for the patients.
Well, we had to thank you for doing it. I imagine you're.
I always
versus I work in an operating room, it's too cold.
Sure.
I'm shivering on the way home, and you're ripping your clothes off.
And I always tease that we need a palm tree in the corner, but we haven't gotten it yet. So.
And I was reading a little bit about children in the home. This is kind of interesting. To review this a little bit, keep little children out of the kitchen, like 5 years and under. The most likely way a child under 5 will get a bad burn is from hot food or liquid in the kitchen. Now, there's a big point. I mean, that's a big point.
It's a huge thing. We see, again, scald injuries, particularly food scald injuries, a lot. And the biggest culprits seem to be macaroni and cheese, because the children really enjoy helping, helping the parents make that type of thing. Also some hot cereals, and then also, coffee can be a problem too, and anything out of a hot microwave too, that can be it can be an issue. You just need to be aware of it.
You have to watch where you put the handles. The child can reach up and grab the handle. Use the back burners.
Use the back burners. Keep the handles on the pots and pans turned away so that they can't reach those.
And they can't reach the cords.
Never bring a chair up to a stove so the child can help you. I mean, it's a very significant problem. We have patients we have to graft every year because of scald injuries.
Because of that. And I understand also they shouldn't use cloth near there where they can pull hot food, soup or something off the dining room table. You have to be very careful, the kids pulling at that, because they're trying to climb up, and having a child in a kitchen is very dangerous, isn't it?
It is.
And the same with, I think, probably keeping matches and lighters in the home. People who smoke, they literally need to be locked up.
A lot of the residential fires are caused by children playing with matches and lighters. It is a huge problem.
And let's face it, if you're smoking, there's fire in the house.
Yeah, exactly.
There's fire in the house. And you have to look at it like that. That indeed is fire in the house.
Thankfully, recently the state legislature has passed a bill to make it so that the cigarettes actually extinguish much quicker. So there are new cigarettes now that extinguish quicker, so that it does decrease that risk. But again, there still is a risk there no matter what.
Smoking in the house is just a bad idea, because especially one for the children or somebody breathing this. I see so much lung cancer in young people going to the brain. That's what I operate on. That I really down on smoking.
And the other component of the smoking people don't think about is just peripheral vascular disease. I mean, I see patients that have chronic wounds and need amputations every day from smoking, causing problems with their circulation. So.
I've seen patients from smoking with circulatory problems where they amputate the toes, the ankles, the legs, and they still pop away.
Keeps going on.
And I don't know how, how they...
And we see patients smoking on oxygen even though they have
Yeah. And
chronic pulmonary disease.
They could just almost
They're
explode,
smoking on
couldn't they?
oxygen,
Yeah.
and they do sometimes. We see
They
that, probably about 6 times a year we'll see at least,
Yeah.
those number of patients that will be smoking on oxygen and it basically explodes in their face.
And die. And some of these burns that you see ruins the trachea and the bronchi, and that's the reason they need to be intubated
causes even more troubles.
on
Exactly.
a respirator. Tell us a little bit about gasoline injuries.
Yeah.
And how I know you see quite a few of those.
Yeah.
And they're.
I wanted to make sure we talk about that because
Yeah.
gasoline is a very significant problem. We see it particularly, in the springtime when things are still moist. People want to burn, the leaves that have fallen last year, all of the branches that have fallen throughout the winter. And in order to get a fire like that started, it's very challenging sometimes. So they'll get out the gasoline, and gasoline is the last thing you want to use to start a fire. Or have gasoline close to a fire or anything hot, because the problem is gasoline is explosive, and it's not necessarily the liquid that's the problem. It's more the fumes that are explosive, and we see many times, particularly again in the springtime, where people are trying to ignite fires, and particularly if it's a very humid day.
Yeah.
That will keep those fumes a little lower to the ground and more concentrated, and you can see where the flames just shot out and got them, low sometimes. I mean, it's just a very significant problem, gasoline and fires, and you just don't want to use them. You just don't want to use gasoline.
I understand that, and I remember a neighbor of ours that where these oils and things that you use to clean things, and other things part of the car, and they store it inside this little drawer in the garage. And they open it, it just explodes. And I've seen whole houses burned down from that. So
I mean,
chemicals,
the fumes and chemicals
is very dangerous. And in the workplace, you really have to be very careful. If you work around these kind of things every day, you can't have people smoking and they're working for a gasoline oil company.
Sure.
And people do sometimes, and this thing just causes many deaths and horrible burns. And tell us a little bit about some what you consider interesting cases, the most difficult case you say, for example, or and advice you could give us from that. A little bit about what are you looking at?
We have a lot of interesting stories, obviously, of burn survivors and that sort of thing. One of the patients we had that had a very large burn, 95% burn, ended up being with us for almost a year, actually, to get him through the whole process, getting through all the potential problems and things that go along with a burn injury. And we've had a lot of really great, processes to get these burn patients through. I mean, we've had some really great saves, I would say. A lot of patients that we've brought through that
Why did they lose their memory
challenging.
for the event? I mean, they were in there for 2 months. You talk to them in the office, and they don't remember a thing about it. Why
well, that again
is
kind of the induced coma. We use a lot of Versed, which is a medication that causes patients to forget. And that's a good thing because they don't remember the painful parts of the process either. Because when they're in their initial stages, we take them back to. We don't do actual kind of whirlpool therapy anymore, but we have a hydrotherapy room that's a specialized room where we bring them back to clean the burns off. We have warmed water, that sort of thing to clean the burns, and it can be a very painful process. So getting them through that with the pain medicine and the medicines that help them kind of relax and forget things as well.
I mean, pain is a significant part of
the
burn situation.
It is.
How do the patients end up, say, psychologically after a major burn? How do you find them? Most of them recover pretty good?
Most of them seem to recover pretty well. Obviously, it's a process. We do have, again, as I mentioned, a psychologist that helps us with the patients, and they're from day one. Initially helping the family, and then once the patient themselves is able to communicate, they're always talking with the patient. Get them through those stages, because you have stages where you go through initially where you deny things, and then you kind of work through where you're angry, and you just kind of work through that injury. It kind of depends on the mechanism of the injury as well, but it is a process getting these patients through.
It really is life-changing event,
It
isn't
is.
it?
It
Major
is.
burn
Yeah.
is really a
Yeah.
life-changing event. Tell us a little bit about fundraising and things you do at the burn unit, but considering how important it is, considering we have only 2 burn units in this whole state,
Yeah.
I think to keep it there,
Sure.
I think we all probably need to muscle it up a little bit.
Yeah.
And I see you brought with you
Yeah.
a method that St. Joe Burn Unit does some fundraising.
Yeah,
Would
we
you tell us
basically-
about? Some people might like to participate.
Yeah,
I know I will,
Sure.
because
One of the things
I didn't know you did this.
One of the things that we started, I think it was started many years ago when St. Joe actually became a for-profit hospital. They needed a not-for-profit arm to collect donations, and what the donations do is to help the burn patients themselves, sometimes helping with dressings to cover the dressing costs, sometimes helping with gas cars to get patients back and forth. Again, being only one of 2 in the whole state, we cover a large area. So trying to get patients to and from is a very challenging thing as well. But we basically have what's called the Northeast Indiana Burn Council, and this will be the 4th year we actually have a prom, and this year it's going to be March 19th at the Grand Wayne Center. And that's to raise money, again, for the families of burn injured patients and the burn patients themselves. And we actually have set up a 4-room burn family suite similar to a Ronald McDonald House down at St. Joe. And the families can stay there for a very minimal charge. And it's just a very neat facility. We really have an excellent facility there for patients' families to stay while they're in there because, again, 50-60% burn, they're going to be there for a few months.
They can't stay in a hotel the whole time.
Yeah.
So that's, I think, is excellent. You know.
Yeah, our old burn center, most of the families waited in the waiting room area, and you could see, because we didn't have anywhere for them to stay, and those families don't want to leave the hospital. They want to be by their loved one, and you could actually see on the wall where their heads would rest up against the walls. There was actually areas that you could see that they just stayed in that area. So it's just a really neat thing that we were able to raise money to have a comfortable place for them to stay and close by their loved ones during that.
Yeah, thank you for bringing this up, and especially I'd like to thank you for the work that you're doing there, because I know you're not getting paid to treat these patients without insurance anywhere near what a plastic surgeon normally would make. And I know a lot of people, a lot of nurses, doctors are really muscling it over there, and that's, I think, is appreciated by myself and the community. And any interesting stories you have about children that you treat there?
Well, that kind of reminds me real quick, too, that Burn Awareness Week is the first full week of February. So starting February 7th is Burn Awareness Week, so we're pretty timely with doing this. And through that, the Burn Center is helping out with some burn awareness type things. And one of the things is some of the nurses are going to do a story time here at the library. And that will be sometime during that Burn Awareness Week, so people can call the library to kind of find times for that, but it'll be something to do with burns and awareness of burns and that sort of thing. They're also going to have kind of a talk at the Lutheran Health Center, which is the new ice skating arena, and the Lutheran Health Sports Center, I guess is what it is, to have information on burn awareness there during that week as well. And some other things, they're going to be on TV, they're going to do an article, and I think business people, that sort of thing, to help create awareness of burn injuries. In terms of the children that we take care of, again, we've had some really neat children that we've taken care of over the years, brought them through some very significant injuries, and one of the ones that's more memorable is we had brought a child over from Afghanistan and treated some severe burn contractures. He's back now and doing well. We have another opportunity that we're looking into, again, bringing another child over from Afghanistan to help take care of those types of problems, mainly burn contractures, because a lot of patients in these countries that don't have as much care as we have, they don't treat them as much, and they get significant long-term problems from the burn injuries. So that's kind of an exciting thing that we're able to, and we're looking at doing here in the next few months, probably trying
that's
to bring
God's
that
work,
about.
isn't it, really?
So.
Yeah, this is wonderful. Highly deformed children, probably with Is it arms or legs or
Yeah,
both?
in this child, it's mainly arm and armpit area that he's pretty much stuck in this position.
Yeah.
So what
Yeah.
we'll need to do is release everything and graft everything and
Yeah.
try and prevent that from coming back.
When you put these grafts in there, are they grafts put in there with the blood supply, or do you just move it from the leg to there?
Yeah. You'll actually take a very thin layer from another area, and again, with the big burn patients, that's the problem, is you don't have uninjured area to borrow it from. So we'll actually borrow it, let those areas heal, and then reborrow it again. So we can actually reharvest areas quite a bit. But someone like that, we would do a skin graft, take that thin layer, this area would heal on its own, we transplant it, and then it needs to get blood supply from the wound bed.
By laying it on the wound bed.
Yeah, and usually within 5 to 7 days it will have that new blood supply growing up.
Do you rotate a flap sometimes where you actually have to anastomose
we will
1
occasionally.
millimeter blood vessels?
Yeah, we will occasionally.
Can you connect 1 millimeter blood vessels?
You can, you can.
Just think of the skills.
Yeah.
I used to do it in the brain. For strokes, they don't see that work too good, so we're not doing that anymore. But hooking up 1 millimeter blood vessels with 10 stitches takes a little bit of skill.
Yeah, occasionally we'll have to bring tissue from somewhere else, particularly in the head and neck area, to fill in areas where there's skin loss. And we can actually bring tissue up with its blood vessels attached and reconnect the blood vessels in the area that we're taking.
Do you use loupes or microscope?
Usually use a microscope for that.
Those vessels are, when you just think 1 millimeter, I mean, it's a hair. You know, and you're putting 10 stitches in there.
Sure.
That takes a little bit of doing. So why don't we summarize a little bit here?
Sure.
And what we're really trying to do is prevention. We're prevention. And I would say number one is each family has to have a plan. You have to have a plan.
I think that's a huge thing, and I'm going to go home tonight and talk to my family about it, because it is something. I'm
not 100% on this myself. I'm going to move that hammer up in the bedroom in case I get a knockout, the window. But sort of starting in the kitchen, we got to keep little children out of there.
Sure. Yeah.
And we have to have the handles turned away, and maybe use the back burners if at all possible. And we can't allow little steps a child could use to get up there.
Exactly. It's not a play area. Definitely not a play area.
It's not a play area. We have to watch that coffee pot in the morning. We have to make sure they can't reach a cord and pull and then have that spill over them.
Yeah, the other thing with cords is we do see those on occasion where a child will actually have the female end of an extension cord and actually put it in their mouth, and they can get bad burns around the mouth. Not very common, but it is something you just have to be aware of. Electrical burn that way.
And that's one I never thought of. And your animals can get injured that way too.
Sure.
You have to watch that they jump up there. My cats can jump pretty high. And you have to watch your pets. Although they're usually pretty clever. They really get near things like that. They can almost sense it. But then Christmas trees, for example, if you get a real tree, you got to watch it. I have nothing but artificial trees. And not that a light couldn't come on and we could have, some fire could occur because there's some heat in the light bulbs, obviously. But if you have an artificial tree, you're much less likely to have a fire because a real tree can just explode.
Yeah, and the key with that too is to make sure your tree continues to be watered and stuff, not let it dry out, because that's a big component of that too.
That's a big component. And if you have any solvents around, any oils around, don't store them. Don't store them in the house.
You don't want them near heat or flames.
No heat or flames, and just the gases from them, without even a match, can cause them to explode, cause fires.
And anytime you smell gas, make sure you get out of the house, notify the gas company or notify the fire department, because we've seen some house explosions, where they'll come in, they'll have a leak, at the hot water heater. They'll work on it a little bit, and then, they try and relight it, and it explodes.
Remember we spoke about the carbon monoxide monitors and the fire monitors, the smoke alarms that we have those in the house. Let me tell you one little story that not that I had one house fire, that's bad enough. From a recessed light, it's out. That type of light is outlawed, but they were in the homes when I bought it, so I didn't know that was outlawed. And caused the fire. But I'll tell you another one. I was practicing my saxophone, and my wife was at the lake, and I put a couple of eggs boiling them over there, and then I'm playing away. I forgot they were in the kitchen. I look at my cats are going crazy. Then I investigated, and there were my eggs boiling through the bottom of the pot.
Really?
Yeah, there was a hole in the pot. So I opened every window, called a maid up, and I said, "You tell anything to my wife, you don't have a job." My wife walks in from the lake on Monday, says, "Where's my favorite pot?" And so it's a kind of dumb. That was a dumb thing, but I was concentrating, on doing something else, and almost burned the house down doing it.
Yeah.
So
you have to be aware when you're cooking that.
What's going on?
What's going on?
And I don't enter the kitchen very often, so frankly, that was quite easy to do. How many people work in your group over there in the Burn Center?
Well, we have 4 of us in Summit Plastic Surgery. That's the group that I am part of as a plastic surgeon.
Yeah, all 4?
There's 4 of us that do burn
in there.
surgery. Yeah, out of the 7 of us in the group, there's 4 of us that work in the burn unit.
Yeah.
As a plastic surgeon too, sometimes as an aside, sometimes we actually use heat for plastic surgery procedures, resurfacing the skin to remove wrinkles and that sort of thing.
Yeah, exactly.
Obviously, that's something we're able to control, but it is essentially a burn, and we use that to actually help people too. So not all burns are actually completely bad, but you want to prevent these significant injuries that we're talking about.
Do you use lasers at all?
Yeah, we use lasers and those sorts of things. So it's something that we do use, burns, and essentially that's what it is, a laser resurfacing. But you just need to have control over it, obviously, and know how to treat those and get those to heal, so that patients do well and have an improved cosmetic look, that kind of thing.
Do you have anybody in the hospital right now that's, say, exploded a met lab or anything?
Currently we do not, but there have been times during the last year where we've had 3 or 4 of those types of patients in the hospital.
It's been significant, so it's extremely numbers. Common, and it's something people just ought not to do, because it can. There have been a lot of deaths, permanent injuries.
There have been,
and
there's
now,
a lot of patients that don't even make it to the hospital from those types of injuries.
And now they face a jail sentence on top of that.
Sure.
And horrible bills following them behind, which obviously they're not going to pay. But it's a terrible situation. So prevention of fires is very important. The same, I think, in the car. You drive a car, get a major accident, burns are not uncommon.
It is,
and you need to run away from the car, shouldn't you?
Yeah, particularly this last year, we've had quite a few car fires, and they tend to be very deep because you're in an enclosed space, and those fires can be very, very hot. So we've seen a fair number in the last year. So it is something that you need to be aware of. Get away from your car if you can, very quickly, so that you don't have those types of injuries.
Yeah, especially when the truck car accident, you don't know what's in that truck, for example. So anyway, I'd like to really thank you, Kevin, for coming here tonight and educating myself and the public about fires. I really learned a lot, and I think probably we may have saved a few lives tonight.
Yeah, hopefully.
Prevention is really the answer, and that's where the Cashman Mind Body Institute, which I run, is about. I do full-time neurosurgery, but I spend a great deal of time as Dr. Wellness. I'm trying to get people well. So we're having this series of talks about trauma and fire and about anxiety and stress in people's lives today. And especially like to mention that I'm quite interested in chronic pain. I see so many patients in my practice that I see as patients that are on 4 or 5 narcotics for reasons that I don't understand. So I paid a little special emphasis, with you tonight, and I want to congratulate you to be one of these physicians that with your patients, you have an endpoint. You know when the narcotic is over, and life continues that, which is, I'd like to really point out, that's a wonderful example of what I try to do. Thank you very much for watching this, and I hope we've helped prevent some burns in your family and maybe saved a life or 2 along the way, and I appreciate it. Thank you very much. Namaste. Good.
Well,
Great job, Kevin.
Thank you very much.
You did a wonderful job.
Yeah, thank you.
My little thing gave
That's
out.
good.
It was really felt good when I knew exactly the minutes. You know what I mean?
Yeah,
I don't know. Got it, 20 minutes.